name is Srikari, Kurada, and welcome back to our second episode of Inside Med. Today we have with us Dr. Amanda Bell. So why don't you share with us a little bit about yourself, what you do, and anything else you'd like to share.
Well, thank you for having me. And my name is Amanda Bell, and I'm currently a Dean of Arizona College of Nursing. I have roughly 25 years of nursing experience, probably the last 15 in executive leadership. And I have just the most amazing job. I am able to work with fabulous nurses that really commit to the quality of nursing, the professional makeup of nurses and what that entails. And then also we get to together collectively affect the health outcomes of the community. So we're very fortunate to be able to do that. And like I said, I have an amazing role, an amazing job, and I couldn't do it without a team.
It's great to hear. So that's what your job entails. What would you say is your amount of patient contact as your dean? Would you say you have a lot of patient contact or minimal amount? And how do you think that impacts what a student wants to do when they go into medicine?
So that's a great question. There are a lot of academic nursing deans that I collaborate with in Connecticut. A lot of them have been in the academic space, and they haven't been in a hospital setting in a long time, and therefore I can speak that their contact with patients was probably very minimal. Okay. I took a very, I would say, a non-traditional route, and I started as a bedside nurse for quite a bit of time. I was a nurse educator for a number of years, which still kept me at the bedside. And then when I went into more of a hospital administration side, I did lose that aspect of having contact with patients, which I really missed, but I never lost my contact with students or nurses who had contact with patients, and through them and their stories, it still felt like I made an impact on patient lives.
That's wonderful to hear. So you mentioned your journey to get here wasn't really traditional. So based off of that, what steps did you really take to become, a dean of a nursing college? And do you think it was really difficult to get here? Do you think your non-traditional route made it easier or harder for you to be in the position you are now?
So that's a lot. But, I would say, I think with the grace of God, I'm in with the position, that I'm in. When I say non-traditional route, nursing was a second career for me. I went back in my late 20s. I was a single mom, divorced. I worked full-time and raising, a daughter. So, like many of the students that I interact with today, my story is very similar to theirs. And so I really have a lot of empathy for a lot of the nursing students and what they're dealing with life. It's not easy to juggle nursing school and that kind of life and have it be cohesive. I think, to answer your question, everybody has a different journey and a different pathway. I never thought, looking at my 29-year-old self, that I would be a dean of a nursing school. I think at that time, I always thought I would be a bedside nurse, caring for patients. The interaction that I receive from patients, I feel like I gain more from them than from what they gain from me. So that was a big satisfier for a long time. But I did know at some point, probably 10 years into being a bedside nurse, that, physically this may, take a toll on me. I want to have options. I just didn't know what I wanted to do, but I knew that going back to school starting with, going back for my master's in nursing was the first step to getting kind of closer to if I wanted to go, somewhere else or aspire to do something else, that I at least would have the education to support that. So I really didn't know at that point what I wanted to do. But along the way, the last, I would say 15 years, I've had a series of opportunities that led me to where I am today. And just, I can say I'm very grateful for those opportunities.
It's great to hear. So, did you always know that you wanted to go into nursing? Did you know that you wanted to go into healthcare in general? Because I know that's a case for me specifically. I want to go into healthcare, but there's so many options. So, how did you handle that? Or did you always have a set goal in mind? I want to go to nursing. And once you answer that, what advice would you give to kids who maybe are in the same position as me? They want to go into medicine, don't know what field, and just overwhelmed by the amount of options there are out there.
I want to say that I always wanted to go into nursing, but really that wasn't the case. When I was in junior high and when I was in high school, I remember feeling very envious of my classmates that had a very clear direction in what they wanted to do. And I really felt inferior because I wasn't at that point. And I just don't know if it was an immaturity on my side, or there were so many options I really couldn't narrow it, or perhaps I was just having too much fun in high school socializing that I didn't take the time to really think about it. I had other priorities, having fun with my girlfriends, going to the movies, and being a social butterfly, and things of that nature. So I really did not have a clear direction. For me, it really was a life transition that brought an opportunity forward to me. And that's when I kind of said, well, I always liked to care for people. And I remembered as a little girl playing hospital with my dad every Sunday afternoon, and he had the patience of a saint. And I would wrap his finger and make pretend bandages. And I think this was like as early as 8 and 10 years old. So even back then, when I think back, I wanted to heal, I wanted to care, but it was just articulated in a different way. I cared for my animals. I, did drawings that reflected, serenity and healing. I just didn't know at the time I was going to end up where I am.
It's wonderful to hear. And what advice would you give to any kids, that are in the same position you were back in junior high, don't know what field they want to go into, and maybe just feel really unsure?
I think, that's okay. There's a lot of pressures for young adults to, figure out what they're going to do in life. And I find that, respectfully, your generation, for the most part, you know exactly what you want to do. And many of you have a very clear head in how to achieve that desired outcome, desired goal. And so I applaud your generation, for that kind of instinct and drive. My generation was a little different. We didn't have that. And I do believe that the guidance counselors at the time, there were really generational differences. So still, women were kind of relegated to go to, this kind of focus area, and males were, relegated to go here. And so I think that the sky is the limit for your generation and probably the one before you and for future generations to come, which is very exciting. But I would say if you know what you want to do, then you take kind of those micro steps to achieve that goal. And if you don't know what you want to do, but you do know that you want to go to college, any kind of a Bachelor of Science will really lay down the foundation for whatever you choose to go to.
Sounds great to hear. Now I wanted to dive deeper into your role specifically, what you do. What does your job entail, and what are some pros and cons of your job? And would you recommend it to, high schoolers or medical students in general?
I think it's really difficult to describe, I think, a role of a dean to someone who is in high school. I think you can describe kind of overarching themes, but I don't always understand, the position in terms of where it's evolving to, because things change so much in healthcare. And a lot of what we do is responsive to healthcare demands. The hospital setting, they pivot in terms of labor practices, and schools are just the same. So it's very challenging to be in any kind of nurse leadership role, I think, in today's environment, just because it's so complex. But I would say, overarching, if you have patience and you like to lead small groups, large groups, to a challenge and to be focused to achieve a desired goal, and you are a natural-born team leader, then that is something definitely to look into. Nursing is a profession that affords so many opportunities, and there are leadership roles that are needed at the bedside. There's leadership roles that are needed in management, and on the academic side where I am, there's definitely leadership roles aplenty for high school students, and if that's what they aspire to be.
Yeah, they should just go for it.
Absolutely. Sky's the limit. I always tell my daughter that.
It's wonderful to hear. So high schoolers, going back to this idea, are there specific classes or things they should be doing right now, to maybe get like a head start to jump into healthcare, something that might put them, ahead of the curve? Because I know a lot of people, there's like accelerated nursing programs, accelerated medical programs, and people who want to get into that and, get a head start on their career as soon as they want to. What would you recommend to them? What classes should they take? What things should they partake in outside of school? Any words of advice for that?
Sure. And I'm just going to use my own experience for an example. So I went to a traditional school, but I was a non-traditional student. So I was a little bit of an outlier, but I do remember the students that did exceptionally well, that were traditional students, really excelled in the math and sciences in high school, to the degree where many of them were in honors classes in high school, where they had some high schools offer that kind of opportunity. And so the chemistries, the biologies, the maths, taking pre-calculus and some of those honor programs really set those students up for success. I would say that when I went back to school, those classes were over 5 years old, so I had to, take them again. And as an adult learner and having so much space in between, it was a struggle. I did what I had to do, and I set high standards for myself, so I was able to achieve, the grades that I wanted to. But I would say that if you're a traditional student in high school going into the nursing field, and you are a traditional student and that's going to be your trajectory, to really take the time, focus, and excel in those math and sciences. They'll really serve you well. Nursing is, it's an art in how we practice, but the root of nursing is also foundational in the sciences.
Because it is a medical profession as well.
It is.
Right. So nursing school in general, I know there's like a Bachelor of Science in Nursing. So what would you describe the environment of nursing school as? Very, I assume it's very difficult, to get into the process of getting into nursing school, the process of going through it. But what would you classify the environment, the whole process of applying, getting in, and would you recommend that to students?
So I've been in the academic space for probably 15 years, full-time professor, adjunct at various universities and colleges, and then, most notably in my current role. And I think, some of the difficulties that you hear or perceptions about nursing school, I do believe that students are from a different, generation, and they have different expectations. I think that's the biggest difference, is the expectations that what they perceive is very different from the reality. Secondly, and I applaud, these students that are going back to school, but yet they are kind of like, me, when I say, they worked full-time and they're managing families either as a single parent, that the demands of nursing school don't change, and so what needs to shift are priorities for students when they are really fully committed into nursing school. The likelihood that a student can work full-time is really minimal, and the likelihood that you will survive nursing school without a good support system is also, going to be a challenge. However, I do know that if you have that tenacity and if you are dedicated, our most dedicated students who really want the dream come to reality, they do what it needs to be done to be successful. And sometimes that's just putting some of the life things over here while you prioritize school. And currently, our school is a 3-year program, and you receive a baccalaureate degree, a bachelor's of science in nursing degree. And most schools offer that in a 4-year span. So right there, you're shaving off, 1 year,
Right.
but you are going through the summers. But it's really kind of, what does the student want to achieve, and what is their time commitment, and can they really commit to the rigors of nursing school?
So now you explained a little bit about nursing school. What do you think are some common misconceptions or misunderstandings? People who aren't even, going into nursing, that like a stereotype people might have about nursing. And how do you think that really impacts their viewpoints on people who are nurses or people who want to become nurses?
Nursing is still the #1 profession where people trust.
Right.
And the reason why they trust nurses, and we've been the most trusted profession for a very long time, and I believe this is according to Becker's Healthcare, it's because of all the things that we serve the patient. And so there is a lot of foundational knowledge that that nurse needs to have and be able to demonstrate it, practice it, and provide that education to patients. And it requires a very comprehensive education. And I think for some students, and most recently, because we just started a new semester, and students have come to my office and they said, Dr. Bell, I didn't realize how much studying I have to do at home on top of attending classroom and then the clinical component. I do believe that there are some students that believe that what they receive in the classroom and clinical is it. But there's a lot of information that students need to have in order to be really competent, compassionate, and caring practitioners. And a lot of the information that they need to digest and learn is self-directed. And so about 1/3 of the total time really requires the students to do on their own. So I think that's a misconception that it's kind of one-stop shopping. They get it at the school and they're, one and done. I think the other piece too is when you are caring for a patient, you're looking at patient, body, mind, and spirit. We look at things holistically. And for some students, they have not appreciated that, holistic approach. And in order to treat a patient holistically, there's a lot of knowledge that's required to
Right.
attain, to be able to deliver that kind of, empathy and caring.
Right.
So I think those are really the two things that I would say are probably some misconceptions is the amount of work and commitment, and then once they're committed, like what that knowledge looks like. It's
Right.
a very comprehensive package that students receive in that 3-year time.
Right. And so now gearing this towards you, what was your path towards, where you are now? What were the ups and downs? What was the process you took, after high school? Did you go straight to college, straight to medical school, or straight to nursing school? Did you go into any accelerated programs? And, if you could go back and change something, would you, about your process to getting where you are now? Would you change anything at all?
So I am what I would say, a mature learner. And I do believe that if you asked me this question 20 years ago, it would be a different response.
Okay.
But I have to be honest with you, looking back, there were a lot of ups and downs for me and my journey to get where I am. And I wouldn't change it for a minute, because through those, I would say, ups and downs, I was able to experience and have opportunities afforded to me that really kind of molded and shaped who I am now. And I do believe that I've had those experiences afforded to me, so I'm able to share with my team. Some of it is to really kind of use as a mentoring tool. In other ways, I share because I want them to avoid some of the pitfalls that, I know that if you go down this, this way, you may experience that. So, try this approach. So a lot of what I experienced today, I truly feel was meant to be, even though at the time it was sometimes a real struggle. When I went back to school, it was a second career for me. And like I said, I was a single mom, so it was not easy. I had to juggle full-time work and raising a daughter, going to school. But you know what? I never lost sight of really, it was more of a personal goal, really more than a professional goal. My personal goal was, how can I influence the future nurses that are going to be taking care of me or my parents? And how can I have the most influence in doing that? And so that's really what led me to this position, is I have the ability to lead other leaders, and together and collectively we are changing the shape of the profession to ensure that we sustain nursing excellence for a very long time.
And that's incredible.
It is.
Really is. So speaking about future nurses, future leaders, how would you suggest they can get experience into the field of nursing early on? Say, high schoolers who know directly they want to go into nursing. How do you think, or what opportunities do you think are available or they should take to go into that career path?
We can learn a lot from what manufacturers do. So manufacturing has done a wonderful job with creating apprentice-type programs, stepwise approach to, getting to, where you need to be. And, I think nursing is, we've had a little bit of a lag, but my recommendation, if you want to be a nurse, but you're not sure, you can do what I did, and I became a CNA because I knew conceptually I wanted to be a nurse, but realistically, being in the environment and, caring for patients holistically, it's not for everyone. And so I chose to go that route because I did not want to invest in a lot of money in a profession where, it really isn't for me. And the first day that I was a CNA and I was helping, feed one of the residents at a skilled nursing facility, And it was just the smile that I received back. The person was nonverbal, but she had a smile on her
Right.
face. And I spent time with that patient in the nursing home. And that was enough of a satisfier for me to know and validate that I wanted to go into this profession. So I think every individual is going to have that aha moment of what validates, right, that they're going down the right path. For me, it was just a simple human connection, interaction, and I knew for sure that this is the route that I wanted to go. So I would say, A, get your CNA license. If that is something that, for instance, time and money, that is not, an affordable option, although there are a lot of, relatively inexpensive programs out there, then, volunteer or ask to shadow. That is something that we're seeing a lot more students do, is doing, a shadowing experience to see if that's something that they want to, go down. But again, it is a snapshot in time when you shadow. You may not get like a full complement of what it's really like. But if you're in high school and you're going back to school and you're unsure, you're so young that you're able to, to pivot and go a different direction. And the time that you spend on education, it's not wasted.
For our final question of the night, what do you think differentiates nursing from every other healthcare profession, and how does that make it stand out, make it more special to you than any other healthcare profession, such as, being a surgeon or physical therapy? What makes nursing so special?
So for me, nursing touches the human being at their most vulnerable time. And I do believe that there are other disciplines that are equally as important because it requires a team. But if you take a patient in a hospital, for instance, and you are working a typical 12-hour shift, that is usually 36 hours that you will spend with that patient and that patient's family. And that's an incredible amount of time to gain trust, have a human connection, and really see that patient heal in a way that some of the other disciplines don't get to see. And so I call nursing kind of the glue of healthcare. We are probably make up for 70% of the workforce in a hospital setting. And the interactions that we have with patients far surpass any other healthcare provider. And I think it's what we give. Like I said, and I mentioned before, nursing, it's rooted in science, but there is an art of nursing in the delivery and how we care for patients. And I think that's what makes it really, our profession stand out. And I know that the patients, when they leave in the hospital or any other healthcare setting, it's usually the nurse that they remember.
Right. And that's incredible. And it's great to see that you've made such an impact on people's lives that way as well. So if you have any final words you'd like to say to anyone, you can go for it right there.
No, I just want to thank you for your time, and thank you, Rocky Hill Community TV, for having me. It's my pleasure, and it's been an honor.
Yeah, thank you so much.
Thank you.
Thank you so much for joining us today on our second episode of Inside Med. We look forward to seeing you next time. Have a great night.